So many people have symptoms, and oftentimes they'll approach their primary care provider and say, listen, I'm having these symptoms. Obviously I'm having low energy, I'm depressed, I feel anxious. And so many times they'll convince their primary care provider to do a lab panel for them, and they come back in a quote unquote normal range. And so they're not necessarily optimal ranges. And that's what we're treating in my clinic is we're looking at optimizing those hormone levels. So even though the numbers may look normal on the lab values, the patients are obviously symptomatic, and oftentimes they're ignored by their provider. I'm Andy. I am a nurse practitioner. I specialize in hormone optimization, and I'm located in St. Louis, Missouri. My practice is called Reclaim Med Spa and Wellness. Early on, I've always had a passion for helping people. I think that's pretty common for most people that are in healthcare. And so I was a nurse for many years, a trauma nurse, a helicopter flight nurse for many years. And then I went back to school, to graduate school to become a nurse practitioner. I worked in internal medicine for a while after school, and it was frustrating because I couldn't spend as much time with my patients as I wanted to. And oftentimes they had illnesses and chronic illnesses and things that just could not be corrected in primary care visits. I've always had an amazing passion for wellness and preventative health, and so that's when I decided to open my own practice. So in internal medicine, the uphill battle was not having enough time to spend with patients. When I opened my practice, then it was a matter of getting patients in the door until the word got out there. Yeah, so in traditional medicine, there's always the issue with dealing with insurance companies. And so, you know, with my practice, it's a cash-based practice. We don't have to deal with insurance companies. And so I get to treat patients the way they want to be treated, what feels best for me. And I'm not confined by what insurance companies are telling me how to treat. Yeah, I've always loved the feeling of autonomy. And when I was a helicopter flight nurse, there was a lot of autonomy there. We obviously worked under protocol, but we had to, make decisions very quickly. And I really valued that opportunity to have autonomy. And so I was able to rediscover a lot of that autonomy when I opened my own practice. Yeah, I think freedom is a good way to describe what it's like to have my own practice now, and able to treat patients the way that they deserve to be treated. Many of them come in with complex issues, and unfortunately, their primary care providers don't necessarily have the time to spend with them to get down to the root cause of what the issues are. And I fortunately allow that in my practice. I allow a sufficient amount of time to spend with each and every patient. So many of them would say, I haven't felt this great in so many years, or often they would say, gosh, I just haven't felt like I've been listened to in a very long time. I've gone to many different providers and nobody really sat down and listened to what my issues are. So that's an amazing feeling when you get that feedback from patients that they've been heard and seen, and somebody is really holding good space for them. Yeah, I started my practice in 2021 as Reclaim Men's Clinic because I saw so many men suffering from obvious symptoms of low testosterone, fatigue, decreased libido, weight gain, difficulty gaining muscle mass, brain fog, depression, anxiety, and so I have a personal connection with that as well. I've been on testosterone replacement therapy for several years, and I know firsthand how life-changing it can be. And so, as my practice grew, I was seeing more women with similar complaints, and so they would often come to me and say, I've seen my doctor about this. I have normal labs, but I just don't feel well, and nobody is listening to me. And so I decided then it's time to expand my practice, start treating women as well. And so I pursued advanced training through HRT University, led by Nico Misla. And I completed their master course, which is testosterone replacement therapy, advanced hormone therapy for women, weight loss, and thyroid optimization. And I'm also part of a group of a nationwide group of collaborators of other HRT providers, and where we meet weekly and discuss complex cases. And so I really feel blessed that I've had this opportunity to expand my practice and to provide HRT for both men and women. And so my focus now is really on longevity and sexual wellness and optimizing hormones. I would say the perfect candidate is somebody that has buy-in to their health and wellness, somebody that is committed to long-term care with hormone replacement therapy, knowing that it's not a quick fix. So that person who obviously has symptoms, and they have lab values to back those symptoms. Yeah, well, first of all, not everybody is a great candidate for hormone replacement therapy. And I would say those people who aren't good candidates are those who just want a quick fix. Somebody that has a pretty poor lifestyle, they have bad nutrition, a lot of alcohol intake, poor sleep. And so they don't really have a foundation built for a good lifestyle. So if they are committed to improving those areas of their life, hormone replacement therapy is just going to just really bring everything up a notch and just really optimize all of that for them. So the best candidates really are people who have buy-in, who are really committed to looking at this long term for a lifetime of just feeling their best and optimizing their health. Now with social media, there's a lot of exposure about hormone replacement therapy for both men and women. It's no longer taboo. There's more awareness that there is help out there. And so as we're getting more and more providers trained in proper hormone replacement therapy, this continues to grow. And patients have more of a buy-in now. There's more trust. And so it's an exciting time to be a part of this community of providing hormone replacement therapy for men and women. Well, there is hope. So, let's just step back a bit. Let's just look at lifestyle, right? And let's talk about, how you're sleeping and what's your stress level like and what's your nutrition like and are you exercising? And then, let's do a lab panel. Let's do a comprehensive lab panel. And, we're not looking at just, say, testosterone alone for men, right? We're looking at total testosterone and free testosterone and sex hormone binding globulin, DHEA. And for women, it's also looking at testosterone and progesterone and estrogen. So it's important to get the overall picture of both lifestyle and labs. Yeah, I think there's some confusion about that in the general public. Part of it is because, it used to be taboo. It used to be, for men, a lot of men would come in with shame because, they, were getting testosterone black market. For women, it was the big scare about the Women's Health Initiative. And so even though that's all been debunked, there's still that fear out there. So it's important really to educate patients, show them the evidence, and so that they're comfortable and there can be shared decision making between me as the provider and them as the patient, and also involving their partner and other family members as well in the decision making. Sort of the process that works is, patients will usually contact the office. Most people want to talk about it first, so usually we'll have a phone conversation. Some people come in knowing that they definitely want to check labs and hoping that they're good candidates and get started. So at a minimum, we talk about lifestyle and kind of like their overall health to begin with, and then start with a comprehensive lab panel. Once those results are back, a few days after getting blood drawn, when I get the results, I review them, and then we set up their first appointment. Um, and most of that is done virtually now. So I'm seeing men and women virtually for hormone replacement therapy and weight loss. So with their intake forms that they complete, doing an overall history, kind of like what their main issues are and complaints, along with their labs, then together we can determine a treatment plan for them. And then once they start on therapy, I'm going to recheck their labs 6 or 8 weeks later. Obviously, there's going to be some more frequent monitoring. There's going to be contact with them. That's one great thing too. Is like my patients have access to me. They can get a hold of me very easily. So follow up is very consistent. There's a lot of continuity of care because I am their provider. They're not seeing a different provider each time. And then continual lab monitoring after that, somewhere between 3 to 6 months. Obviously, if there's a change, somebody's not feeling right, something is off, obviously we're going to recheck labs sooner. Um, but I love that, if patients have access to me, I always encourage them, if something is not feeling right, I want to hear from you, right? Um, I know you're probably going to be feeling on top of the world. That's great, and no news is good news. But please don't hesitate to reach out. We can always make adjustments. Yeah, so I usually tell patients, here's what you can typically expect when you start on therapy. And it kind of goes in a stepwise fashion. So usually soon after starting therapy, within a couple of weeks, most people start feeling better, like emotionally, psychologically. They just feel a bump. They just feel a little bit clearer. And then with that follows energy levels. And then, the big question is like, then when is my body going to change? When am I going to start gaining muscle and losing fat? So typically around 3 to 6 months and beyond is we really start noticing those body composition changes. But it's a lot of those psychological effects that take place early. And then, of course, as time goes on, we continue to have continued improvement. Yeah, so some people want to know like how long I'm going to have to be on testosterone replacement therapy or hormone replacement therapy for women as well. Usually, it's a lifetime commitment. They're coming in with symptoms that didn't develop overnight. It's been kind of a slow progression into feeling like they are, and so it tends to be for a lifetime. There are a few patients who like really tweak their lifestyle and make some amazing changes. We decide to come off, and they're doing okay. But for the most part, most people are on it in it for a lifetime. But oftentimes, the question will come up, well, what happens if I start therapy and I decide to quit? Am I going to harm myself? And I love that question because it's a very good one. And the answer is no. If you're on it like many years, obviously, if you're coming off, it'd be best if we tapered off. But short term, if you stop, you're going to go back to where you were baseline, right? Minus the time, that we've spent pursuing this. So those are all really great questions. I love it when patients ask me that. So this is not cookie cutter protocol treatment. Each treatment is individualized for the individual. And so dosing is determined a lot by symptoms. We use labs as a guideline, of course, but we're really looking at symptom relief. And dosing is usually how we're able to achieve that. Yeah, obviously, hormone replacement therapy is not going to fix everything, right? So it's a combination of proper dosing, proper medication, along with lifestyle modification. And I'm not expecting patients to change overnight, but most patients, when they start feeling better and seeing the effects of the medication, they're encouraged then to change their lifestyle. So I notice nutrition improves. They're becoming more active. They're having better communication and better relationships. And so they have more of a buy-in then once they start feeling better, they're really committed to changing overall lifestyle. So obviously not we're not looking at just labs. So we're going to run through a questionnaire. So for instance, for men, a lot of men are kind of shy when it comes to talking about what their symptoms are. So oftentimes I'll just go through a list and then I'll see them shaking their head. Yeah, that's me, that's me. So it's things like low energy, weight gain, decreased muscle mass, poor recovery in the gym, decreased libido, erectile dysfunction. And so, many men are experiencing some. if not all of those symptoms. And so that's a good telltale sign. And then we have labs to back that up. As far as women, it depends on where they are in their stage of life, but so many women are suffering from perimenopause or menopause. And so, they're going to see things like, obviously decreased libido as well, energy levels are changing, maybe a new onset anxiety that they never had before. And they're noticing changes in their body, they're gaining a lot of weight. And so, again, looking at symptoms and then matching that up to what their lab values look like. So many people have symptoms, and oftentimes they'll approach their primary care provider and say, listen, I'm having these symptoms. Obviously I'm having low energy, I'm depressed, I feel anxious. And so many times, they'll convince their primary care provider to do a lab panel for them, and they come back in a quote unquote normal range. And so they're not necessarily optimal ranges. And that's what we're treating in my clinic is we're looking at optimizing those hormone levels. So even though the numbers may look normal on the lab values, the patients are obviously symptomatic. So it's a combination of symptoms that they have, and oftentimes they're ignored by their provider, and so they're usually out doing a search online for what their symptoms are and perhaps what clinics are around them that could help them. And so a lot of patients they do their homework ahead of time. They do a lot of research before they ever come in. So most patients that are coming in for a consultation already have an idea of what they might need. They definitely know that their symptoms match up with what they're seeing online, perhaps, or talking to their friends or colleagues who have similar complaints. And so a lot of them come in already knowing that. Listen, I finally found somebody who's going to listen to me. I have these symptoms. Let's work on a plan to get me feeling better. So obviously, our goal is symptom relief, but it's more than just relieving symptoms. It's about really optimizing their life. So I'll see so many people who, once they start on therapy, obviously a lot of their symptoms start to disappear, but they also notice other improvements in their life. Their relationships improve. They get promotions at work. They're feeling a better connection to their community. So these are all like, not necessarily measurable results like we can see on labs, but obviously it's a side benefit of optimizing their health.